So now we're going to take a little bit of a turn and look at the New Jersey marketplace. I think New Jersey is a really interesting case study. There was some discussion this morning about New York, and it's not growing as quickly as some might want to see. But New Jersey is a story of reinvention, and this reinvention has happened over a 20-year period. So in the early 2000s, the pharma had kind of a silo research model where they had everything in-house and all of their R&D and their discovery was taking place within the pharma company. That changed for a variety of economic reasons in the early 2000s, and the pharmas began to decentralize and locate operations closer to academic institutions. I think Novartis was probably the first one to make a major move when they put their global research headquarters in the NECO building in Boston and Cambridge, Massachusetts, and moved all of their research operations out of Switzerland. And a lot of other pharmas followed suit. And so what happened in New Jersey was all of the pharmas that had these large suburban campuses, just moved out of them essentially over time, and they left behind lab space that was in many instances great space, but totally underutilized and vacant, mostly in the suburbs. And New Jersey has begun to repurpose those campuses into new innovation hubs and new innovation centers with a variety of programming and uses that are included in it. And so you're going to hear about some of that reinvention now. In the first panel that we're going to listen to, this is all about reinventing New Jersey's infrastructure and ecosystem through strategic policies, collaboration, and state-of-the-art infrastructure projects. It's growing and continues to attract cutting-edge innovation developments like Helix, New Jersey, a 13-acre, 1.7 million square foot hub in downtown New Brunswick. Similarly, you heard New Jersey Institute of Technology's incubator of 110,000 square feet of space. This is where the Merck Digital Studio is located. And the ecosystem is supported by organizations like BioNJ and HAINJ, which you will also hear from, which represents most of the healthcare institutions in New Jersey, working together to move the state forward. This panel will be moderated by Sho Islam, the Director of the Office of Business Engagement and the Department of Economic Development in Middlesex County. The speakers will be Debbie Hart, the President and CEO of Bio New Jersey, Chrissy Badius, President and CEO of the Healthcare Institute of New Jersey, Michael Johnson, President of the New Jersey Innovation Institute, and Chris Palladino, President of the New Brunswick Development Corporation and CEO of the New Helix Development. Welcome them.
We'll try to provide you a nice little overview of New Jersey's infrastructure and life science ecosystem today with really an A-class team that we have assembled here. My name is Sho Islam, Director of Middlesex County's Office of Business Engagement, which really helps growth stage companies access products, resources, services to help them accelerate their growth. So you could think of, grants, incentives to, subject matter experts, or site selection. We do have a lot of space that we're going to talk about, space that we have and space that we're building up. So those are coming up. And for those of you who may not know Middlesex County, it is smack right in the center of the state, home to giants like J&J, Bristol Myers Squibb, Novo Nordisk, but equally important, it's really a thriving ecosystem for growth stage companies that are really being spun out of all the R&D and research work being done at Rutgers University and Princeton, which is right nearby. So with that, if you are a company or if you know of companies looking or interested in expanding their New York metro footprint, more than happy to chat with you. And with that, maybe we'll get started. Everyone has extensive bios on the stage, and that's available on the electronic program. Please do take a look at it. We do have limited amount of time, so I'll pass the baton right on to Debbie Hart to give us an overview of New Jersey's life science ecosystem.
Thank you, Sho. And is the slide controller here?
Is this it? Is this what this is?
There you go.
Oh,
Here you go.
yep.
I don't know.
Thank you. Thank you, thank you. So I'm assuming the green button will make it work.
There you go.
Or not. There we go. Okay. So good morning, I guess, almost. Debbie Hart, President and CEO at BioNJ, the Trade Association for Life Sciences in New Jersey. Happy to be here with you to tell a little bit about the New Jersey story. I know there are amazing things going on in New York, and we wanted to make sure that you heard some of the New Jersey story, which I believe you will do in the next two panels. Just very quickly, what I'm going to be reporting on is a report that we did and we released at Bio last year in San Diego, this past summer in San Diego. It was a partnership between BioNJ, Choose New Jersey, JLL, and the New Jersey Economic Development Authority. And so, there are a couple, lots and lots of innovation that's happened over the years, a couple that we wanted to highlight here. So New Jersey's the birthplace of immunotherapy, immunology, home to the cure for hepatitis C, the first ever CAR T-cell therapy, the first FDA-approved 3D printed drug, and also the first FDA-approved digital medicine. Lots of things to be proud of. Also, some of the highlights. So New Jersey, companies with a footprint in New Jersey were responsible for more than 50% of all new FDA drug approvals last year alone. And so that's the general statistic that we can share every year, anywhere from 40 to 50%, and we're expecting more of the same from our companies this year. Nearly 4,500 biopharma establishments. Some of the largest companies are located in New Jersey, and we have a very large presence of FDA manufacturing facilities, in fact, the largest in the nation. 40% of all cell and gene therapies are coming out of our region. We have talent. We'll hear more about that as we go through this panel. You'll probably hear some about it on the next panel as well. Tremendous count of scientists and engineers, 63 academic institutions, and the medical device, which Chrissy will talk about, I'm sure, that industry has grown 21.4% relative to 2018. Some of the top life science companies, and this is just a smattering of them, but names you'll certainly recognize. In terms of higher education, Princeton University being the #1 academic institution again this year in the country. #2 public university in the country, New Jersey Institute of Technology. #2 most educated state, and a high concentration of STEM awards in New Jersey. Again, talent. It's what we're known for. The industry is putting out nearly $121 billion in economic output. Direct jobs is more than 75, close to 76,000. Total jobs is more than 350,000. We won't go through this slide, but again, you'll hear smatterings of it in the next two panels, but lots going on in terms of building the workforce. Again, also real estate, you're going to hear a lot about that, so I won't spend any time here either. In terms of the lab rental rates, New Jersey is, in terms of the life sciences industry, unmatched affordability, frankly. As you look at this chart, you get the picture. The EDA in particular and the Commission on Science, Innovation, and Technology have a huge array of different incentives that support the entire spectrum of industry, from the smallest to the largest. If you're looking to move anywhere, you should look at New Jersey, certainly. Look at New York as well. Look at the region, because we are a booming region, and New Jersey is a great place to raise a family. And that is my story, and I will hand it over to Chrissy.
Hi, everyone. Good morning still. So I'm Chrissy Butis. I'm the president and CEO of the Healthcare Institute of New Jersey. We represent New Jersey's research-based biopharmaceutical and medical technology companies. Again, a trade association that really works to advocate on behalf of these industries before our policymakers, both in our state capital in Trenton, New Jersey, but as well as before our congressional delegation in Washington, D.C. And we're all about promoting patient access, innovation, and jobs, and promoting our state's economy. As many of you know, we are known as the medicine chest of the world, and we work every day to make sure that we retain that name and work to strive to grow that innovation economy. And that's why I'm thrilled to be up here on this panel that's being moderated by Show and led by Middlesex County up here, the greatest county in the land. As somebody who comes from Middlesex County, I can say that, but I'm thrilled to be up here with my colleagues Debbie Hart as well as Michael and Chris from NJIT and DevCo. So it's really what I was asked to speak a little bit about is what are some of the regulatory landscapes that our life science industry is really facing moving forward, and what is Hinge, what is Bio, and some of our other trade associations really facing moving forward before our state legislatures as well as our congressional delegation. And that's really around different price control mechanisms that are being put in place, and something that we are very, very mindful of, and something that can really put a damper on innovation. So we are educating our policymakers to be very mindful of those policies and that damper effect that they can have on our innovation economy. We're also mentioning that, and I'm sure all of you have heard, hey, drug pricing, it can be expensive. Well, I can assure you that our drug manufacturers are very cognizant of that fact and welcome the conversation around drug affordability. And so we're pushing for PBM reform because we offer rebates to our PBMs and to our insurers. We want to make sure that those rebates actually make it to the patient. So you're seeing our manufacturers really lean into this conversation and have that dialogue with our policymakers. And so you'll probably hear a little bit through our conversation about what's really new on the horizon, what are we excited about, and that's of course around AI. And wow, we have a lot of potential there to bring drugs to market faster, bring cures faster to our patients who need them. But hey, we're in the Northeast, and it wouldn't be the Northeast if we didn't have a real conversation about what's going on around our tax climate as well. And so we do live in a higher cost state, and so we do have the highest corporate business tax and some of the highest other taxes, but we are proud of, as Debbie mentioned, our top of the line education system and other things that these revenues afford us, but we certainly want to be balanced in that moving forward. And then again, Debbie mentioned workforce. Can't agree with her more on that, and we'll get into more of the specifics around that, but New Jersey has really been working across the board with our academic institutions, but also with our partners here in the workforce as well as with our companies to really bridge that gap about what is needed in the workforce today so that our academic partners are meeting the demands, not just of today, but of tomorrow. And that's not only in our four-year institutions, but also in our 2 years and our VOTAX, but in high school and as well as in middle school, and happy to talk about that further. So thank you.
There you go. Michael? Good afternoon. Michael Johnson. I'm the president of the New Jersey Innovation Institute. It's easiest to describe our organization by what our purpose is and why we were formed. So about 10 years ago, NJIT, the state's polytechnic university, realized they, like most universities, had a fundamental problem, which is it's very tough to work with universities for the outside world. Universities in this country are where most of our basic research and innovation happens. Governmental organizations, industry, they want to work with research universities, but it's very challenging. Academics do not move at the speed of business. They don't follow deliverables, timelines. They don't respond to emails very well. They are tough to work with and tough to interact with. And what NJIT decided to do was something that's very unique in academia, is they created a separate organization, and not just a separate department or separate college. They actually created a wholly different corporation at NJIT called the New Jersey Innovation Institute, which is a 501c3, a non-for-profit, with the sole goal of connecting industry and government non-governmental organizations to the university and leveraging all of the resources of the university. What makes it unique is that NJI is able to move at the speed of business. We have our own CFO, our own president, our own accounting team, HR team. We can move at the speed of business while leveraging all of the resources of NJIT. And today, as far as our organization size and scope goes, we have about 140 employees. We do about $40 million in projects per year for Department of Defense, Department of Health, and we operate in 5 distinct areas: artificial intelligence and machine learning, defense, which is mostly advanced manufacturing, healthcare, entrepreneurship, and professional and corporate education. And we also run an incubator about 110,000 square foot right in the heart of Newark today. And for us, we're ultimately focused on accelerating innovation, fostering translational research, and also upskilling workers in New Jersey. So if you're interested in working with us on any of those programs, definitely get in touch as a follow-up to this.
All you.
Okay, I'm Chris Palladino. I am, amongst other things, the president of the Helix now. You know, when I talk to graduate students either at the Blaustein School, at the Fell School at Penn, or at Kennedy School, LBJ, and ask them where do they believe that like public policy starts, usually get answers like, you know, a task force or some type of special interest group or lobbyists or the Chamber of Commerce, Elon Musk. And I say maybe, yeah, for things important like education and tax reform and those types of things. But, you know, what truly sparks the real interesting stuff is an idea and then the opportunity to pitch it and having some luck. So with respect to this project, 7 years ago, hanging around the governor's transition office, senior policy advisor says, hey, Chris, we need a real big idea for economic development. I said, I got one. And, you know, having thought through the fact that New Jersey started to see so much of its research kind of gravitate, you know, not only to the Research Triangle or San Diego, but in Kendall Square, and that no longer were drugs being produced or the beginning of this, the basic science behind, you know, guarded gates on 202, but, you know, in somebody's garage or in a lab, in an incubator, is that we really need to do something to kind of jumpstart the innovation economy. And I think that really was something that Governor Murphy came into office with. A lot of the work that these guys are doing are all a beneficiary of that. So we decided to, you know, really build our own innovation district in New Brunswick, a place where academia, startups, mid-sized companies, larger companies can kind of collaborate in hopefully an ecosystem. And it's probably an overused word, but in a, you know, a kind of a collaborative way. People weren't locked behind doors any longer. They were things that were happening in Cambridge in coffee shops were probably just as important that were happening in laboratories. So resulting in what is going to be a $2 billion innovation district on 4 acres in New Brunswick, about 1.5 million square feet. The first building is under construction. I think it is the only place in the country where there is a large university-based translational research center, a medical school, and a large incubator accelerator in one place. It is $800 million investment. It's probably the largest investment in life science in New Jersey. But Rutgers is investing $250 million in recruiting 80 new principal investigators. Those 80 new principal investigators could bring somewhere between 600 and 800 new people to this facility. And they're actively recruiting those people and have most of them on board by the time we open in 26. We expect over the first 10 years of this project, $100 million in new license revenue to Rutgers, and about $900 million in new third-party research being funded at this site. 2,000 jobs in the first building, $500 million in economic benefit to the state, net benefit to the state in the first 10 years, and according to our economist, and the EDA bought it, 5,600 jobs being spun off over a 10-year period. So that's just the first building. We've got other things to talk about. We've got Nokia, we've got the third building we're doing, but that's kind of an introduction to how we got there. It was an idea whose time had come in New Jersey.
No, Chris, one of the things that's interesting, every day I get to enjoy this building going up outside our windows, so thank you for bringing it to life. As you mentioned, there's a lot of partnerships and a lot of partners involved in this project to bring that 1.7 million square feet of space. What has been your experience, and what are some critical partnerships, and what do you think this innovation corridor will have as far as impact to Central Jersey, I would say, but also to the New York Metro life science sector?
Well, look, I think building partnerships isn't easy. A lot of people talk about it. I've kind of grown up in a culture of people talking about public-private partnerships, and then you ask them what they mean, and they kind of stutter. We kind of pride ourselves on having really done that in a whole variety of ways over time. But look, we got Princeton and Rutgers, who have been good partners in a variety of research at Cancer Institute in New Jersey, which actually, I'll kind of go back for a second. No, it doesn't work that way. Which will be opening its new $1 billion facility with 30,000 square feet of oncology research being conducted. So we've got two universities. Very quickly, through some work that we did with the governor and Jonathan Holloway, we're able to create relationships with Tel Aviv University, and there's also research projects that are going on right now, and the Atlantic Technology Institute in Ireland. We're working with a couple of universities in India and in Korea. Probably the most important and interesting partnership that we could put together, because they usually don't necessarily play well in the same sandbox, is bringing Robert Wood Johnson Barnabas Health and Hackensack Meridian, which are the two largest healthcare companies in the state. They cover probably 2/3 of the state, with an extraordinary diverse patient population, which is really important when you're doing clinical trials and things. To bring them together, to actually have a presence in this building and work together on a variety of things. And then Middlesex County, in New Jersey, counties don't usually step up and do this, but Middlesex County is putting an entire technology laboratory in this building. And then the EDA has been an extraordinary partnership. So, what we're hoping, and I think you find this in New York, you certainly find this in Massachusetts, is that where discovery happens, where innovation happens, where commercialization happens, companies grow, usually within 20 miles. And fortunately, in Middlesex County, we have an extraordinary base of both culturally and educationally diverse population. And what I hope the biggest impact is that within 15 or 20 minutes of New Brunswick, we start to see extraordinary large job growth.
Awesome. And Michael, kind of sticking to Chris's tone on collaboration and partnership, I know NJII was founded on academia/industry partnership. Can you talk a little bit about your Merck partnership and what that means, especially in translating into technologies that could speed up R&D and development?
Yeah, we have a partnership with Hamdi on one of the prior panels talked a little bit about, but Merck had come to us a number of years ago and said that, of course, we're good at developing therapeutics, but we want to look at the digital science space, and it's not an area of focus for us. Can you help us do that? And we worked hand in hand with Merck to develop a program that's focused on evaluating hundreds of companies per year, ultimately selecting about a dozen companies, and then for those companies, investing into them up to about $250,000 and taking them through a 10-month training program, sort of an accelerator incubator type program. And with that program, we as NJI, we run their Cambridge facility where these folks actually come and work. We run all the educational content. And for us as an organization, we're able to both do education, but also foster a partnership like this. It's very tough for a university like Rutgers or Princeton, or even NGIT for that matter, to go out and just sign a lease for a building in Cambridge. It's nearly impossible. We can do that in a day and get that contract signed and start moving on that project. We also have a pretty substantive partnership with Department of Defense and Picatinny Arsenal, where we built for them an advanced manufacturing space to evaluate advanced metal 3D printing capabilities. So we're able to move quickly and form those relationships. The challenge we see is that most academic institutions, they have the resources, they have the people, they have all the right stuff. It's just really hard for them to move and get it done. We're able to actually do that.
Now, staying to the theme of maybe last question on partnership, we could go on for a lot of this, but I know, Debbie, you've been in many different rooms trying to devise the policies for state moving forward with BioNJ. Can you name some policies that's been on partnership potentially that's been really impactful in moving the trajectory of New Jersey's life science ecosystem forward?
Sure, I'd be happy to do that. One particular program that comes immediately to mind is one of the oldest in New Jersey in terms of programs specifically designed for the life sciences. It was the idea of one of our board members back in the mid-90s, and it was turned into legislation and then went to the EDA. The EDA has been effectively managing it ever since. It allows companies, our board was sitting around and thinking, well, what do we have? How can we create opportunities for the industry? The thing that we have the most of are losses. These are the early stage biotech companies. And so they said, how can we monetize the losses? And they went to the EDA, they went to policymakers. And so now, all these years later, the program is the net operating loss program, technology business tax certificate transfer program, where companies can sell their losses for cash, minimum of 80 cents on the dollar. A company like PSE&G, who was the original purchaser of them, is a partner, and they will buy the losses and get that tax write-off on their tax return. And then just one example I want to provide, Celgene. They took advantage of the program in the very first year and then subsequent years after that. But at the time, if Dr. Saul Baer or John Jackson, a former CEO of Celgene, were sitting here, they would tell you that program made the difference for them and allowed them to raise money when they were really having a lot of trouble raising it. And the Celgene story is, one of the most iconic stories coming out of the life sciences industry in New Jersey. The EDA still has that program. Many, many companies are still benefiting from it in the life sciences as well as the technology area. So there's just one, and there are several others that I could mention. The Angel Investor Tax Credit, the Innovation Evergreen Fund, one of the newer programs that the state is offering, all really unique. Best in class in a couple cases, only in class in a couple cases. And again, I mentioned earlier the whole gamut of programs that are available through the state, through the Commission on Science, Innovation, Technology, and the EDA.
Yeah, that's great to hear. And it's, as we mentioned earlier, one of the things that makes New Jersey as awesome it is for life science, it's really the talent pool, right? So having the tools as far as incentives and financing. Maybe I want to pick your brain a little bit, Chrissy, on talent. I know Hinge works on a lot of policy, but also developing that talent pool that's ready to go for the next generation of life science. Can you talk about a little bit about some of the partnerships that you're working with and potentially some unique programs in New Jersey, whether it's RVC or Middlesex College or others, in addition to the four-year colleges, really to make it a steady supply of workforce-ready talent pool?
Yeah, and this is something I'm quite passionate about. I previously came from the New Jersey Business and Industry Association, and everybody is looking for top talent across industries, and I'm sure that's not unique to New Jersey, but certainly New York as well. And some unique opportunities really presented themselves, especially during COVID and when a lot of federal dollars were coming into our various states, and New Jersey pounced on that opportunity. I'm going to highlight at least one program and how it relates to the life sciences and healthcare. A couple partnerships formed of that. One is related to our county colleges, and it's called the New Jersey Career Pathways Initiative. And focusing on the life sciences and healthcare, there was a partnership that developed because there was a need for aseptic processing, as an example, of our life sciences companies. And they said, hey, we need a workforce that's trained specifically to go into our clean rooms. We don't have that workforce pipeline. And so they partnered and reached out to our association that manages our community colleges, and 3 of the colleges got together, formed the curriculum, and put together that program. And again, now it's going into fruition, and they put their, I think, first cohort basically into action. And so 3 of our county colleges, Middlesex, Raritan Valley, and Mercer, will be putting together a pipeline right into our life science companies, right into basically Central Jersey and outward. But the beauty of that is that other colleges don't have to recreate the wheel. They can use the same program and curriculum in their colleges and replicate it. And so that's just one way of having and see that partnership that was utilizing federal dollars that came into the state. I know Chris also mentioned Robert Wood Johnson, another partnership formed between Middlesex College and sending students into RWJ. And so they're trained, so hands-on training right there as well. We hear of BMS having their employees train the teachers, so that the teachers are now, that the employees are training the teachers to teach STEM education in the schools. I mean, there's all these examples of partnerships that exist, and we certainly need more engineers, and I'm sure Michael can even touch upon this. Every time I talk to Stevens, NJIT, Rowan, and anybody from one of our life science companies, engineers are so needed, and if we can get more into the pipeline, I'm sure we would take those as well.
Yeah, one of the things that they've done really well in Middlesex County, Middlesex College is, and the partnership that they've now established with the Cancer Institute is, they said to Dr. Labuti, what do you need? Right. We will develop a curriculum for you to be able to get you those types of folks to work in labs and do those things. And, there's kids now in a program who, when we open that building, are going to be some of the first new employees. So they've been very, very proactive in developing curriculum to meet the needs of industry.
No, definitely. And one of the things is everything related to the STEM really field, whether it's technology, whether it's in bioscience and biology, a lot of interactions happening between all those different subsectors. Chris, I know you have Nokia Bell Labs moving into that. As we think about technologies merging with life science and all the little interactions that goes on that Michael alluded to a little bit earlier too, where do you see that as far as improving the visibility of New Brunswick, Central Jersey, New Jersey, as they relocate their R&D headquarters to New Brunswick, and what impact do you think it'll have being so close to all the healthcare system, all the life science companies, and the incubator that'll be right there?
So, Nokia Bell Labs is moving, and they've been in Murray Hill for 80 years. They're moving 1,000 physicists, mathematicians, electrical engineers, computer scientists. The most exciting thing that they're doing, they're bringing their 12 Nobel Prizes. Yeah. They're bringing their 15,000 square feet innovation center, so people, they're,
in the museum, right?
Right, so people will be able to see all these, exciting things that they've done over generations. In some ways, it's a mic drop moment. Okay, we're done. Not really. Nokia is hitting the ground running. First thing that they have to do is over the next 7 years, half of their employee base is going to retire. So this is an extraordinary opportunity for Rutgers and Princeton and NJIT and Stevens to kind of replenish that pipeline of young talent. But they are out there forging new partnerships with Rutgers. Probably 3 or 4 new research projects have started. And what I find fascinating, I think this has always been, kind of the hallmark of innovation. So much stuff happens by accident. Nokia does so much work. As look, they're going to do AI. They're doing 6G. They're going to run the cellular network to the moon from New Brunswick. I don't know why we need a cellular network on the moon, but they're going to do that. Quantum computing, their drone research. But so much stuff happens by accident, and that it's not part of their commercial pipeline, and then they spin those companies off. And they're working with EDA now in actually kind of creating their own internal incubator with the hope that they'll be able to move across the street and to be able to do, hopefully, and so much of it has become medical device driven. Yeah. We're not going to do this, but somebody else is going to use this technology. But being able to have those relationships, at lunch, at the bar across the street, with folks from RWJBH and Hackensack and Rutgers, we're going to accelerate opportunities because people are having the opportunity to just be together.
And I'm sticking to that a little bit, Michael, when you think about NJIT. The biopharmaceutical industries, I would say, has just started to harness or understand the full potential of artificial intelligence or machine learning. Can you talk about a little bit about NJI's role in adopting AI technology, and specifically your AI lab, and what that entails, and what advancements do you see there?
Absolutely. I find AI in the space generally just very interesting because there's a ton of hype. And the reason there's so much hype, I think, is because it was so democratized so quickly. For years, we use Google, and we type into Google, how do I make a chicken parm, and nothing comes up. A restaurant nearby comes up, an ad for tomato sauce comes up, but not the answer to your question. And then for the first time, my mother types that into ChatGPT, and the exact directions come up, where to buy it, how much it costs, and how to make the portions perfectly all come up. That information was always there. Google just didn't show that to somebody because they're trying to monetize that information. But because of that, it's burst onto the scene and everyone's trying to adopt it. And we as a university are looking at AI and saying, how do we add value? Of course, we have the largest computer science program in the tri-state area, so we have lots of great students. But what do we do that uniquely positions us to add value in New Jersey and beyond and to spur the innovation economy? We looked at space. AI companies don't really need a whole lot of space. We looked at high-performance computing. In 3 or 4 years, that hardware will be outdated. So what do we do? And what we realize is there's a big gap for small and mid-sized businesses where they know they need to leverage AI. They have problems, they know AI can add value, but they don't know how to solve those problems. And for the small and mid-sized company in New Jersey and beyond, they don't want to go to an Accenture or Deloitte and pay $500,000 per FTE to work on a project. So we've spun up an AI lab within NJI where we're doing consulting projects for corporations, primarily small and mid-sized ones, working on small-scale projects where we're leveraging our really smart students and faculty alongside of consultants that work for us to help address those problems. Something as simple as answering maternity leave questions for employees or evaluating where to put furniture in a new building that you're building and providing directions to staff who's doing that. So we're working on those solutions today for those small and mid-sized businesses.
And moving to Debbie, I know we're talking all the good stuff that are going on and all the positive outlook, but when you're talking about advocating for companies, you got smaller companies that started coming up. How do you advocate small startup versus advocating? And Chrissy, you could again, smaller companies versus larger companies. How do they, still keep that momentum going when it comes to policy and policies that advance innovation without hindering accessibility, for example, for larger companies that are looking at affordability versus accessibility?
Right. So it's frankly not that different. Our membership, it does span the full gamut, from the largest of the large companies that you would recognize, some of the logos that I shared earlier, to the smallest of the small. We say down to a man or a woman in a molecule, everything in between comprises our membership. So we need to be able to stretch across that bridge. And policy is the pillar upon which we were founded. So we've been at this for quite a while and have, hopefully successfully maneuvered the challenges over the years. At the end of the day, our tagline, our why, is because patients can't wait. And everything we do is geared around making sure that patients can get the medicines they need. And then also that innovation is happening unencumbered in New Jersey and beyond. And so everything we do at the state and the federal level is geared around those two drivers. At the end of the day, both the large and the small and everything in between, they care about the talent, right? They care about that patients are getting the medicines they need. They care about the larger companies now look very frequently to the smaller companies for their innovation. So they have lots of reason to work together, to collaborate together. And we, it's our job, because they are our members, to make sure that we're bridging that gap.
Awesome. And maybe we'll end it and then take any questions there. Chrissy, when you're looking at it, maybe what do you see in 2025? Now that the election's over, you got kind of a clear vision on where we're headed. What do you see projecting onto 2025 and onward? What are some policies that maybe you are looking to champion in 2025?
So I have 40 seconds. I need 5 hours. No, I'm kidding. But I think AI will certainly be something that we'll be talking a lot about. Regulate, don't regulate. There's a lot of potential, as I said, bringing drugs to market faster, the ability to recruit into clinical trials, the evaluation of mass data as well, and to help with a physician who's going into surgery and you get to have that all simulated ahead of time. I mean, how remarkable is that? But at the same time, making sure that it's not over-regulated so that you're not hampering on innovation at the same time. So that balance is going to be really critical. And not to mention, again, we have have a whole new dynamic, all of us do, federally, as well as somewhat on the statewide level here in New Jersey, in the healthcare space at least. And so yet to be seen, but I can assure you that Hinge will be working with folks from both sides of the aisle. We look forward to it, and I know our members will step up to no matter what comes their way.
The number one question is, will RFK Jr. have a role?
Any questions out there? We'll take maybe one or two questions if there's any out there.
We've answered them all.
All right, seeing none.
Thank you, everyone.
Thank you so much.
Thank you.
Thank you. Well done, Joe.